Hospice. What is hospice? Hospice is care to promote comfort to a person when a cure is no longer possible. Hospice care helps patients and family identify needs and goals when confronted with physical, social, emotional, or spiritual things. Residents are eligible here at Divine for hospice if they have 6 months or less to live, or any life-limiting diseases qualify. Hospice is paid for by Medicare, medical assistance, and most insurances. Care is provided regardless of ability to pay, and hospice does not discriminate. Hospice care team would be doctors, social workers, nurses, aides, counselors, chaplains, dietary people, volunteers, and therapists. There are at least 4 levels of hospice care: routine, respite, general inpatient, and continuous hours. If you feel a resident is in need for hospice, call for a consultation visit. The RNs will do that at the nurse's station. The Hospice Patient Bill of Rights. To receive a copy of the Bill of Rights, obviously that's the right they have, services to be explained, told of charges, told of changes in their care plan. They have the right to refuse any treatment or service, to know limits of services, and payment. They are made aware that they have privacy of their medical and financial information. They have access to their records. They will be served by trained people. They have the ability to voice grievances, resolve complaints, be free from physical and verbal abuse, and have advance notices of any change in services, and to have their pain managed most of all. Communication between hospice and long-term employees is vital. Medicare requires information for facilities on hospice education and orientation, which we're having today, 24-hour contact info, identification of care team members, copy of signed election form, physical certification, recertification forms, identifications of medications that hospice covers, and a copy of the physician's orders. They also will have a hospice visit scheduled, documentation of the visits, and most recent plan of care and advanced directives. And all these things you'll find in the patient's care plan that the nurses will put there. Statistics show most nursing home residents do not want to be moved from their home. Both families and residents are more comfortable around nursing home staff. They've become accustomed to them. They'd rather stay in the nursing home than go to the hospital. Hospice can help people with MDS reporting. The workers for hospice, the RNs, would be more than happy to work with our RNs to make sure that the federal government knows the level of care of that patient. Terminal stages of life. At 1 to 3 months before death, you realize they have decreased their food intake, they've increased sleeping, and they seem more withdrawn. 1 to 2 weeks before death, they have increased restlessness and agitation. They're more confused about time and place. They have difficulty identifying people familiar to them. They have visions of people and things not visible to others, and incontinence of urine and stool. Observations that days or hours prior to death, you can hear moist sounding breathing, difficulty clearing their throat. Breathing patterns change, and hearing thought are the last sense to diminish, so they feel they can still hear you at the last moments of their life. Hours prior to death, changes in their skin color from pale to blue, red, or purple, and modeling. Fevers, surges of energy appearing to wake up and may even request to eat. Usually this is short in duration. Grief. What is grief? You can experience grief or loss here in the workplace because you are connected to the resident and the family. There is no right or wrong way to grieve. Grief is the normal process of reacting to loss. Normal grieving response, that would be you feel numb and shocked, sad, lonely, empty, guilty for some reason, have regrets, and may feel relief after someone passes away. Spiritually dealing with grief, find meaning in the loss. That's what people do often when they're dealing with grief in a spiritual way. They can give or receive forgiveness and may feel more spiritually connected. Physical responses to grief: eating and sleeping too much or too little, fatigue, restlessness, stomach aches, headaches, and body pains, withdrawal from family and friends and social activities. Cognitive response to grief: you may have difficulty thinking, you may be preoccupied with thoughts of your loved one. How long does grief last? Grief lasts until we learn to live with our loss. Grief is like a roller coaster versus a series of stages. We must grieve, we can't avoid it. Time lessens grief. It doesn't mean we have to forgotten or stop loving the person who died. Helping with grief. First, you have to acknowledge that you're grieving. You need to take it easy on yourself. Don't be judgmental of others the way that they're grieving. Everyone grieves in their own way. You need to communicate your feelings. It's always good to reminisce about someone who's passed away. It seems to help release some of the pain. Attending memorial events at your facility, and you need to make sure you balance home, play, work, and rest. If needed, seek professional help, a spiritual counselor, a grief support counselor, and contact the hospice bereavement coordinator. They have services at hospice to help with the people who have had their loss. Grief is a journey we must go through, but we don't have to go through it alone.